As you heard in the local news, Buckinghamshire Health National Health Trust has announced a significant improvement in the performance of its accident and emergency department at Stoke Mandeville Hospital. Last month it met the national standard of 78% of people being seen, treated and discharged or admitted to hospital within 4 hours of arrival at A&E. And as a result, the department has climbed from 48th to 18th place in the country for A&E performance and is consistently now the second best performing A&E in the South East. Ambulance handover times have also significantly retreated during the period. Colin's been speaking to the Trust's Chief Operating Officer, Raghuv Bhasin.
We've been working really hard over the past couple of years and beyond to try and reduce the waiting times in our emergency department. I think when we saw the news and all the statistics published, felt really proud for colleagues who'd worked really hard as a team to create new units so patients can come in and see specialists earlier, and knowing that our patients are getting a better service through all that hard work was really great to see.
So what would you say the improvements down to?
So I think it's a multitude of things. So as I said, we've created some new units that sit alongside our emergency department. So it means patients can go and see a specialist without having to go through an emergency department. We've expanded the hours of our urgent treatment centre at the Stoke Mandeville site so that it runs 24 hours. So patients with minor injuries and illnesses can be seen there rather than having to wait in the emergency department. And we've worked a lot as a team across multiple different specialties, doctors, nurses, therapists, to make sure that we can make rapid decisions for patients and they get the best possible advice as quickly as possible, again, to reduce waiting times.
And have you noticed these changes have really helped?
Yeah, absolutely. So we all know that sometimes we face significant surges in demand. We've had to have patients cared for in corridors at certain periods, but that's been far reduced than in previous winters. We've got a really good positive patient feedback who's noticed some of the changes, and our staff working in the department and in the trust more widely are commenting on how this feels like a much improved place. Importantly, about 80% of our staff are also residents of Buckinghamshire, so they're patients and families of patients themselves. There's even more reason to deliver these improvements.
It really is a good news story, and obviously great that staff and patients alike have really noticed the benefits.
Yeah, and I mean that's ultimately why we're here. We're here to deliver better care for our patients, and we know that having staff who feel empowered and enthusiastic about coming to work delivers that better care. So getting that recognition from them, and just as the news story went out last week, we've had a number of positive comments coming through on social media channels elsewhere. Whilst there's always still more work to do, I think the payoff over 2 years of hard work has been shown for our patients.
And great that you've had that positive feedback, obviously, from patients too.
Yeah, and that's the reason we're in business. We are to get the feedback from patients and to reduce their waiting times and make sure they get the best possible treatment. And doing that for the residents of Buckinghamshire makes us really proud.
Has it been quite challenging in a way to implement these changes?
So we know that demand continues to increase, and the funding we get doesn't always keep up with that demand. And there's more and more complexity as people get older, living with multiple different illnesses. So we're having to manage all of that whilst making change can be difficult. But I think working across the teams, proper planning and testing and trying things, knowing that not everything will go well first time, but learning from that has really been at the heart of what we've been doing.
And the fact that you've increased in the rankings must be a real credit to the changes that you've made and how they are working.
Yeah, and particularly for the teams that work on this 24/7, 365 days a year, getting that national recognition for some of those improvements and seeing how we've improved compared to other trusts is particularly rewarding.
And do you have other improvements planned as well?
Yeah, we're not standing still. As I said, there's still more work to do to try and improve waiting times even more. So we have more clinicians joining in the front door. We're looking at making sure we've got the service delivering overnight and weekends the same way it delivers during the day, and multiple other changes we're doing to constantly try to improve.
And what do you hope patients take away from this news?
So I think it's important to recognise that whilst we're not always in the headlines for the right reasons, that there are improvements being made. People are working tirelessly on behalf of the residents of Buckinghamshire. We're not standing still, and we want to continue to improve to try and keep up with the demand that's coming through the door and make sure patients get the very best service that they can do.
And really reassuring as well for people in the county, to know that their A&E service is moving in the right direction.
Yeah, hopefully, and it means that people know that we're always open for business. That if people do have a need, that they can come to us. Equally, we work really closely with colleagues in GP practices, in the local authority, in other trusts to make sure that where the need arises, we're able to meet it in the best way we can.
And as you touched on, it's a real great, kind of antidote, if you like, to kind of the negative stories that you hear about A&E, especially nationally.
Yeah, and I think it's important to recognise that not everyone is perfect and not everyone gets the service that they need at the right time. But what we're doing is constantly trying to improve. And after 2 years of getting these national rankings, it shows that we are definitely going in the right direction, and we continue to strive to be the very best in the country.
And just finally, what's the message that you'd like to get across, especially about the A&E in this area?
That we are improving, that the residents of Buckinghamshire should expect and are getting a ever better service, but there's still more work to do, and working hard to continue to do that. And I hope to come along next year and talk about even further improvements in the rankings. It's
been a real pleasure to speak to you. Thank you very much for your time.
Colin speaking to the NHS Trust's Chief Operating Officer, Raghuv Bhasin.